Welcome back to OpenLine, talking about medical malpractice. Happens far too often. You may have a story. We encourage you to call in, share the story. We have medical malpractice attorney Clint Kelly with us. One of the issues we're talking about in the hospital that can be so dangerous and has become a bigger issue, the whole thing, blood clots.
Right.
What's going on there?
Right. I didn't even know or understand what a blood clot was until a few years ago. A blood clot is simply a clot that forms in the deep veins of your legs, your lower legs, when a person's been immobilized for a long period of time. Your hip surgery, leg surgery, people who have to be immobilized for 3 days or more. A clot can form in their legs, and a piece of that clot can break off, go through their veins, and lodge into their lungs, and it could kill you. And about 6 years ago, the Surgeon General issued a call to action to all of the hospitals across the country and said, you need to be aware of this problem. It's the #1 cause of preventable death in hospitals. You need to have policies in place and procedures to prevent blood clots. And the most effective way now, Ben, is they give you a shot twice a day called heparin, which is just a blood thinner. And they use that until the patient is able to get up and walk around, because when you walk around, it keeps blood from pooling in the legs and clots being formed. But what surprises me, with all the attention in the medical community that's been drawn to blood clots and blood clot prevention, how some hospitals have simply failed to enact proper policies for blood clot prevention, or worse yet, fail to follow their own policies. And as a result, patients die. I mean, I've got a case right now in Memphis, a 35-year-old man went to a hospital with back pain, just back pain.
Mm-hmm.
They order bed rest for him and tell him, wait till you can have an epidural steroid injection. He never gets his consultation. He lays in the bed, and on day 3 develops a blood clot, lodges in his lung, kills him.
Oh,
Father of 4 children, and he
35 years old.
Yeah, was an office manager at Sheraton Hotels, and it's a case where the hospital did not follow their policy. It's clear. Tragic. In fact, the lady who is the widow watched this show. That's how she found me, and I learned a lot about blood clots in the course of that case. Again, it is, I think, the consumer or the patient having people around them, friends or family members, to question doctors and question nurses to make sure that the patient is getting the care that they need and deserve. And blood clots and infection control are a big part of it.
Let's go to Kenneth. Hello, Kenneth.
Yes, sir.
Go right ahead.
Yeah, I was just thinking, I've had a recent death. I had a son. He was 30 years old, and we're watching TV, and one night, and he sort of I gotta cut this TV down. That is messing me up by hearing me talk.
Right, that's always a good idea. Good.
But so we're sitting here watching TV, and wife happens to look over at him, and he looks a little odd. We're watching the movie. We've had a bet, so he's watching the movie. He wants to watch, but he's not looking right. She says, "There's something wrong." I'll go over messing with him. Trying to get him to pay attention and stuff, but he's out of it. I mean, he's completely out of it. I end up trying to get my wife to get an aspirin, put in his mouth, stuff, when I'm trying to get him to, do something. So I finally end up laying him on the floor, and eventually I get him to, come around and start trying to talk a little bit and stuff, and then I finally got to ask him, what's happened? He said, well, I just went black. He said he don't remember anything. He just went black. So he sat there, and I've had him, get a little bit of wind back in him. He's weak, though. He's pretty weak. I've got him swing my hand. He's known for breaking doorknobs. I mean, he's stout. He's about 6'4", 2.
Well, now, do you think this was a medical issue? Did a doctor?
They take him to the doctor. I get him where he walks out of the house. I get him to walk out of the house. He goes outside. We get him in the car. This may have took 30 minutes from the time he blacks out to finally laying on the floor to getting where I get him in good enough shape. He's took a couple of aspirins. He's drunk a glass of water, possibly even a glass of milk, and trying to get him, just to feel a little bit better about things. So he gets up on his feet and he walks out, gets in the car. It's pouring down rain. It took me another 15 minutes to get to the hospital. So he's there at the hospital. I'm sitting there waiting for him. It took him another 5 minutes or longer to get a wheelchair. It seemed like the longest 5 minutes.
Right.
For him to get a wheelchair, finally get him in it. I'm telling him, just you know, I got you at the hospital. You're going to be all right. You know, it's like, he stands up, gets in a wheelchair. So he goes back to the back, and he's, my wife's with him in. I really don't know a whole bunch about what other than what she's told me, but he seems to have some kind of a seizure after they get him in there. They lay him down on the, seemed like the first bed or something in there, but then they end up having to move him into the critical room. That's, you know, I didn't know they had two, but they got one that's a critical room. So they stick him in it, and, you know, he's complaining that now that he can't breathe, and there's like, you know, it's like a bunch of people in there. I mean, it's like.
Well, do you? Okay, so you think this is terrible? I'm so sorry. What happened?
That's right. He's fighting like a bull in a pen. He's saying he can't breathe, and they're trying to restrain him and hold him down. It's not pretty. I mean, anyway, they're saying that since he can't breathe, they're going to have to sedate him. But I mean, I listened to his heart. I had a blood pressure machine. I've done little extra things to him while he was here at the house. You know, I mean,
right.
I was trying to, you know, he's sort of not. He didn't get out and do a whole lot, but he was strong. I mean, he could do it.
Now, what do you think doctors could have done differently?
I don't know. I mean, that's it. I'd like to talk to somebody, you know, that the autopsy turned out that it was pending. They've done these toxicology tests, and they're all sent off right at the moment. And this happened this last a week ago. It's Sunday.
Oh, I'm so sorry. All right, go ahead here.
Kenneth, here's what I want you to do. My phone number is going to show up at the end, but it's 615-824-3703. I want you to call first thing in the morning, call about 8:30. And then when you get somebody on the phone, I want you to tell them to speak to Nurse Kathy. That's Nurse Kathy. They'll put you through to Nurse Kathy, and I want you to tell Nurse Kathy what happened when he got to the hospital, what the doctors think he died from. I know you don't know necessarily what went wrong. Maybe nothing went wrong. Maybe something did. But she'll know how to guide the questioning, and then I will get back to you, or Nurse Kathy will, and let you know whether we have a case. One of the things you have to look at, obviously, is the autopsy report. He said the results are pending, and that's going to be a pretty big deal. But she'll know exactly what questions to ask you and to get answers. But that's a serious case that needs to be looked at.
That's tragic.
Yeah.
Thank you for sharing it.
I'm so
sorry what happened. If it was a heart attack, how often do you get cases like that? Heart attacks in general.
I've got one right now. They're pretty rare nowadays, Ben, because hospitals know if you come in with chest pain, there's a whole series of things they have to do before they let you out of the hospital. And so it's pretty rare nowadays for a heart attack to be misdiagnosed. But, you know, what Kenneth's talking about, you could have somebody who had an aneurysm. You could have somebody where it could be drug toxicity, an overdose. It could be somebody who has a whole variety of issues, and the question in that case and others is, when the patient got to the hospital, did the doctors and the hospital deal with the situation appropriately?
Mm-hmm. And how long did he have to wait, and that kind of thing?
And did they do the right thing? Did they do the proper diagnostic tests? How long was he there before he passed away? Those are all the types of questions that Kathy will ask Kenneth, and we'll try to find out whether or not something went wrong here, whether it's just simply a horrible situation that nobody could prevent.
We were talking about blood clots before Kenneth called, and then you mentioned infection. You see a lot about that.
Right.
Are you getting cases along those lines where infection is either causing loss of life or serious injury? What are you finding there?
Yeah, I have been, and I've had cases where patients had a surgical procedure, then developed an infection. And in the cases that I've had, it's not the fact they got the infection, it's that the infection was mismanaged. It was either not diagnosed in a timely manner, or it wasn't fought quickly enough. And that an infection bends like a fire. It starts out as a campfire. You know, with a campfire, you put it out pretty quickly, pretty easily in most cases. But when it becomes a forest fire, then you got a whole different set of problems you have to deal with. And so the idea with an infection is get it quickly, identify it as a campfire, and get it then. Don't wait till it becomes a forest fire, because at that point it can have horrible consequences.
All right, we're going to take a break. We'll come back and put up his phone number and everything with more information. Be back right after this.